Gloria has joined as well. Okay. Good morning, I assume. Yeah. Good morning to everyone on the call. Good morning, guys in the.
Good morning.
Yeah, so my name is Jairus. I'm sure you can see that I'm not Juniper. Welcome to today's session. And again, just for starters, Juniper will come and present most of the stuff that she planned. But in order not for us to lose any time, I will try to share her slides for a start and probably lead you to where we can do some things independently until she's back. And she mentioned that you guys are supposed to do some presentations today, if I'm not mistaken.
Yeah, you're right.
Okay.
But it doesn't have
Yeah, perfect. Just give me a second. I was rushing from another meeting, so do some things. Okay. Perfect. Yep. And okay. I'll just share my screen now. So can you see my screen?
Yes, we can see it.
Yeah.
Yes, we can see.
Uh, all right, let me just reshare again. Okay. All right. Yeah, let's get started. Great. So good afternoon once more, guys and ladies, or is it ladies and gentlemen? So I guess today's workshop has got to do with communication, I guess, and at least all of you are expectant of I'll probably be learning how to communicate too. So I'll be part of you for a start. Why is it important for us to communicate effectively? And then, of course, the second thing is that you guys will share your, is it 3 minutes presentation? So we have about 5 to 30 minutes that is left for you guys. And then the rest of the stuff, Juniper will come and present, particularly all the way from the writing, the presentation of scientific, non-scientific stuff, being aware of your audience and probably getting across the most important part of the message and all that kind of stuff. Anyways, the real question really today perhaps that we're trying to tackle is why communicate? How do you best communicate? Making sure that your message is well understood. But like I said, that part Juniper will take over. So I would just like to jump to the part of your assignment. I think you guys were asked to prepare a 3 minutes talk of some kind, or is it one slide? And then each one of you will take turns present to us. And hopefully the idea of this is it's like attempting at a task before you learn how it is supposed to be done. And then after that, Juniper will present, and hopefully as she presents, you can mark yourself, you can literally see what areas you need improving, but also the idea is to generate some discussion around how things are done versus how they should be done, or as well as the different kind of ways in order to communicate and put the same point across, and what are some of the outcomes of those, as well as maybe how best we can all improve our communication and science. And we know that as researchers, we tend to have very many different kinds of audiences. We tend to have other scientific colleagues. How do we communicate to them when we're presenting something to do with our findings? We have policymakers, we have politicians, and so on. And all those, even if it is the same message, it probably requires a different kind of a presentation to be done. So that said, it seems like it's in time for Juniper, but we can wait for her to settle down, and rather let us get started with the presentations. Did you already decide to push?
Oh, good. Hi,
Yes, are you
everyone. Yes.
Okay.
Hi.
Perfect.
So sorry. It was perfectly timed that my doctor called me just as we were supposed to kick off. But you're very lucky that Joss is here to kick things off. So the way it was originally planned that I would give a little bit of a talk, then do the presentations, and then continue with the workshop. But I think it will be just much better if we kick things off, and then we'll get back into the rhythm. Is everyone ready with your presentations? Thumbs up. All good? So what we will do, okay. So what we will do, that if we have everything, I think you're sharing the wrong thing as well. Let me just get this thing sorted. I hope everyone is here.
I did some of your slides in between, so you will have to unhide them before you can see them.
Sorry. Just made a bit interesting stuff. So do you guys have the Google Sheet links as well for the feedback? Or you guys haven't got it just yet? I will just do this. I will share all the links. So to kick things off, again, I'm so sorry that I wasn't here exactly how to start things, but what I have done, because today we won't have that much time to go into individual feedback, what I would really like everyone to do is to log on to that Google Sheet. I will actually just show you how it looks like. So if you log on to that Google Sheet, you will find that we have the participants' names. And as people are giving presentations, try to take a note, like what are they talking about, and just give a bit of feedback, visuals. Great, amazing, something like that.
Oh God.
Flow, not bad, but like constructive feedback on people's flow and clarity as well. And maybe if you have any tips. So again, this is how we have the different speakers, and then you can start writing into one of these sections, and then you would see on Google Sheet that someone is writing here, so you can click onto the next one and start writing in that one. And I'm going to ask again for the demonstrators as well, just to keep taking notes. So we will give each other a bit of feedback. And what I will do is that we will have 3 minutes. Everyone will have 3 minutes. So when you have a minute left and 30 seconds left, I'm just going to say 1 minute. 30 seconds, just to keep everyone on time. And we'll try to make this very nice and quick. So everyone just jumps on and shares their screen. And we are going to start with Powell, if that is okay, because I have your name first. Are you going to be happy to share your screen and give your talk?
Hi, good morning.
Hi.
So I'm just trying to go and set up things. I'm not having my laptop, so if others could jump in and
Okay.
come in late.
Sure thing. Then Kokoda, you're the second person. Are you happy to kick things off?
Yeah, sure.
Fantastic. You should have access to share your screen at the bottom of Zoom with a green button. I know you have done it many times already. What are you doing?
My mic or
Fantastic. So are you ready? 1, 2, 3.
I don't know. Wait.
We were there.
Wait, please. I need to set up some things here.
Okay. I got so excited that I will stop the timer. Let me know. Are you
Okay.
ready? Okay.
You can see now.
1, 2, 3, go.
Okay. Hello, everyone. My name is Yasin Kokoda, a research scientist at the Fakara Health Institute, and I'm working with Malaria Atlas Project, or known as MAP. So currently, MAP is supporting the several countries in Africa in terms of geospatial modeling. And what I'm doing, I'm preparing the malaria epidemiological profile for the three countries, and to be specific is Tanzania, Benin, and Cameroon. And malaria epidemiological profile, it means the relevant information which can help to understand the malaria situation in a particular country. And we collected this information by doing literature review through online resources like country reports, national malaria strategic plans of the particular country, and also we consulted different sources of the partners who are working with specific countries like PMI. And this kind of information, they will help us to understand the context of data, where the data come from, to understand the context in which we are analyzing the data. Also, it will help you, the people who are doing the modeling process, to understand the context. So I think that is briefly about me. Thanks.
1 minute left.
Maybe if one has a question, 1 minute.
Fantastic. Thank you so much, Kokoda. And you did it in 2 minutes. That was absolutely amazing. Thank you so much. Okay, so the next person's name is Harriet. And after Harriet, it's going to be Jacqueline, if you want to get ready.
Can you see my screen?
Yes.
Okay. Good morning. So my name is Harriet Alexander, and I'll take you through some of the it's blank. I'll take you through a project that I'm working on, and it's an effort to understand the different drivers of malaria transmission in hotspot areas. So we know that there's a multitude of factors that go into malaria transmission, and one of them, as you can see in that picture, is availability of health education to the community. But this community also has its preconceived beliefs and ideas about the disease, and also understanding and perception of the disease and the disease prevention methods. So from this community, and one of the drivers that predict whether or not a certain type of information, particularly health education, how it's received is the education level of the recipient. And another thing that drives malaria transmission is housing. So we can look at this guy that is sitting outside his house, and that house has open windows that are not properly screened, and this is a risk for malaria. But his neighbor has a more modern housing and could be is better prevented from malaria compared to him. So he needs to go from this type of housing, which is a risk factor for malaria transmission, and go into a housing type that is protective of malaria infection. But then close to that house, you might find that you have this swamp, which is a breeding area for mosquitoes. However, we also don't know how many mosquitoes are there in this swamp and what breed of mosquitoes are there. And these will all decide whether or not the people living nearby can be infected by this malaria, and how much. And
1 minute.
Okay, so we also have the malaria prevention in pregnant women, and this uptake is also influenced by a number of factors, and one of them is also perceptions, but also availability of these medications. And we also have the quality of mosquito nets, as well as these school children who are usually carriers of the malaria infection, and these all go into predicting whether or not someone tests positive or negative in this with malaria. So
15
most
seconds.
of these are usually studied in isolation, and the idea is to now look at how the interplay of these factors. So we are going to employ a method that will study all of these factors together and how they influence each other. And that is to predict and to decide on which factors should be just 15 seconds, Jennifer.
Okay.
Which factors should be targeted for better malaria control? Thank you.
Fantastic. Thank you so much. And I really loved it that you have clearly followed no text on it at all. And really love the visuals and everything. So thank you so much. It is a really hard task, I have to say. So you guys are doing fantastic. Okay. Jacqueline, are you there?
I'm calling.
Fantastic. Are you ready?
I think we can go. I think maybe the next person.
I think Juniper, the next person will Jacqueline is connecting.
Okay. So our next person on the list is Nema. Are you happy to go for it?
Yes, I can check it.
Fantastic.
Just a second.
All good.
Let me know once you can see my screen.
We can see it. Are you ready? All good?
Yes.
3,
and apologies
2,
in advance.
Yep.
poor network connectivity. So if things are not moving, just let me know so that I can reshare again.
Okay, fantastic. We'll let you know. Go for it. 1, 2, 3.
Okay. So this is a tagline by D3, which is my former organization. And while it may come across as wishful, I think the underlying message resonates deeply with our existing public health systems. I currently work at Farm Access as a digital health coordinator and data analyst, where I support with the design and implementation of innovative solutions that leverage technology to improve access to quality healthcare for individuals and communities. And we do so by closely collaborating with governments, tech partners, and other actors in the global health space. And the solutions that we create contribute in strengthening the existing healthcare system by empowering patients to adopt health behaviors, seek appropriate and timely care. They also enable health providers to provide high quality, standards-based personalized care, as well as they do equip leaders to plan based on well-informed, data-driven decisions. And all of these contribute to high-performing health systems, which ultimately results to improved well-being and health for the communities that we serve. And one of the key questions that drives all that we do is how do we make quality healthcare accessible to everyone, irrespective of who they are or where they're from? Yeah, thanks. That's it.
Oh, that was beautiful. You have 1 minute and 10 seconds left. So thank you so much.
Yeah, if there are any questions, happy to share more.
That's
But yeah, I'll
beautiful.
stop sharing.
Fantastic. Thank you so much for keeping it on time and everything. We'll get back a little bit reflecting on our talks a bit later, but thank you so much, Nema. That was fantastic. Jacqueline, are you happy to go for it, or would you like a bit more time?
I will go.
Fantastic. Then start sharing your screen if you can. Fantastic. We can see your screen now. Oh, good. 1, 2, 3, go.
Okay. Currently, I'm dealing with data correction, management, analysis, and spotlighting as I support other researchers, senior and some juniors. So I just prepared the one for general because I can go specific to a single project or analysis. So just in short, doing some data correction activities. This is the one that presenting data collection after correction, and also do some management, like rearranging them and whatsoever. I also do analysis for the data, the difference data, including some environmental and health data. And I also prepare reports and manuscripts. Thank you.
Thank you. You have done it in 1 minute, 10 seconds. So that was absolutely amazing. Thank you so much. That's fantastic. Thank you. At the end, I feel like, oh, we're going to have so many questions as well. So for the next person would be Phoebe. Are you ready?
Yes, I'm ready. Let me share my screen.
Fantastic.
Can you see? Yeah.
Yes, we can see it.
Okay. Hi, everyone. I'm going to talk about the AFETEC project. The AFETEC project is the digital platform connecting patients to CHWs, drug outlets, and health facilities. How do we do this? CHWs, as they visit the households, when they get to know the danger signs from any member of the household, they are able to connect them to the health facilities. But in case they find the minor illnesses, then they connect them to the drug outlets. And for the drug outlets, when they get to recognize a patient coming to their shops with any danger sign, then they're happy to share them, to connect them to the health facility. And the health facility is there to receive all the patients coming from the CHW or the drug outlets and give them services. And this is done through a digital platform. Why do we do this? For the why, it's to reduce the death that can occur in the society, but also for the easy access of the drugs from the drug outlets, but also to improve the health coordination and health care for the vulnerable group, that is the RAMICA group, the pregnant women, mothers, postnatal mothers, adolescents, together with under 5 children. Thank you.
Thank you so much. You had over 1 minute left, so beautifully done again, Phoebe. So the next person is Oscar. Are you ready?
Yes, I'm ready.
Fantastic. Great, we can see your screen.
Yes, so it will just be a continuum of what Foiba has presented, because we work on the same project, which is the AFETEC project. But I will mainly focus on the small intervention that have been established in 2023. That we mainly focus on the promoting of the use of long-lasting insecticide nets in Kibaa region, of which before conducting the intervention, we conducted a geospatial mapping to see the place with high prevalence of malaria. So as you can see, the place with the dark spot, the intense color, it means the place with high prevalence of malaria. So after seeing this place with high prevalence of malaria, we're also looking on the number of new cases over the past years, starting from the 2021. As you can see, there was a slight decline of the new incidence in Kibaa region, in the Kibaa district. Also, we managed to conduct a baseline formative assessment to assess the risk factors that contribute to the high prevalence of malaria in Kibaa district, and we found that most of this community are not slept under the long-lasting insecticide nets, and also the existence of the water or stagnant water. So during implementation, we work with healthcare providers to provide sensitization to pregnant women and postpartum women. And also during the clinics, they provide the long-lasting nets. And also they be provided with SP and ALO for malaria prevention. So the bar chart you can see, there is the red one, which presented before intervention, which there was number of new cases, 110. But after our intervention in 1 year, there have been a reduction to 50. New cases. So to align with the SDG of 2030, we hope to reduce up to 0 incidents. Thank you.
And 1 minute left. Amazing. Thank you so much. This was fantastic to see. The next person is going to be Sarah. Sarah, are you ready?
So Sarah is not around today. She's not feeling well.
Oh, okay. I hope she'll feel well. So let's go. Powell, are you ready?
Okay, I'm just connecting the internet for the laptop. I should be ready within a few minutes.
Okay, Wendy, are you ready? Are you set up?
Yes, I'm set up. I can present.
Fantastic.
Okay, let me share the screen.
Hope the Zambia is
Are
going
you
to
are you
be.
able to see?
It's loading. Fantastic. We can see it. Are you ready to kick things off? You're muted at the moment.
Okay, thank you.
Okay.
So the question we are answering is what, how, and what. So this concept is coming from the discussion I had with my mentor I was allocated with just some few days ago. And the concept is to try and identify the role of climate change in having malaria cases, those that can be resistant, or an increase in terms of malaria prevalence in Zambia for the period that we had a drought. I think this is a worst drought that we had last year for the past 23 years. And so we have a mosquito there that is causing some diseases in humans. And while the humans are also slightly contributing to the climate change, and then we have the remote sensing system there that is able to detect the climatology data that can be used for us to understand if there is a relationship in terms of malaria prevalence and the climatology data such as temperature, humidity, rainfall, and as well as wind speed. Thank you.
Thank you so much. You had 1.5 minutes left. So thank you so much again for keeping it on time. And then last but not least, Powell, are you ready?
Yes, I'm ready.
Fantastic.
Let me share my screen. And it's in the slideshow.
Okay. You have started sharing.
Okay, is it?
We can see it. Go for it.
Nothing has been cut. Okay, thank you so much. So as can be seen, not annotate. Sorry. Okay, I just want to show in terms of the pictures. So my name is Power Kafanka in the corner there. And in the pictures I have, besides my picture of my face, are the 4 pictures that I need to bring your attention to. So to start with, it's the hospital where I work. I'm a medical doctor by profession. So I work at the Invest Teaching Hospital, which is the highest referral hospital in Zambia. So this is the picture of our hospital here. So the concept of this project is to try and model the predictors of the bad outcomes for all those patients that get to be admitted to our facility with severe malaria. So when they come in at UTH, we want to see how do they transition, or what are some of the predictors or factors that make them transition into either being dialyzed, which we know it's a bad outcome, or indeed being dead. So those are going to be taken as transition states. So there are 3 states that we have: the admission state, the dialysis stage, and the mortality stage. So someone can come in and straight transition into mortality, or they come in, we admit them with severe malaria, and the transition into them needing renal replacement therapy because of the acute renal failure that is resulting as a result of severe malaria. As we know, it's one of the features. And that's the center of it is this, that I think it's a malaria mosquito transmitting the Plasmodium falciparum, which is a species which is notorious for severe malaria. So we see that this is, they are either in stochastic space. Okay, stochastic process transitioning amongst these four states: admission to renal replacement therapy to mortality, or indeed just straight from admission to renal. And want to see what are the factors that get to push these patients that are into severe malaria into these different states. So that's all about the project. And this is being seen at different intervals, 30 days and 3 months. Thank you very much.
Thank you so much. You had 28 seconds left, so beautifully done as well. So,
okay.
Enormous thanks for everyone. It's such a shame that Sarah is not here, but you have all done beautifully. It is such a hard thing. So what we're going to do is first, it would be great to know that first, you'll have a little bit of feedback on that Google Sheet. So hopefully that will be a bit useful for all of you as well. And it would be fantastic to hear, like, did people practice the 3 minutes, or was it hard? Was it relatively easy? How did you prepare for this? Feel free to jump in. I cannot hear in the DAR office.
I think, hi, can you hear me?
Yes, go ahead.
Yeah, I think the questions that you shared with us did help to sort of like frame the context. I think it would have been a bit more difficult had it just been us sharing about what we do, but like the how, why, what, sort of like provided a framework that we could work around. The no text was quite a challenge, but it was a good challenge. So the tricky part was just like figuring what visuals would clearly represent exactly what we want to talk about. But yeah, otherwise it was a good exercise.
Oh, thank you so much, Noah. I know it is really hard with the no text, and I think some of your feedback will start with that you did put some text on there. And I know that it's so tempting to put text, and when you know, you're being tasked with no text, then you realize that, oh, this is hard. But the way I'm going to start sharing my screen. So again, do apologize that I wasn't here when we kicked things off. But I'm so excited with this workshop because communication is very, very close to my heart. And going to hopefully cover a lot of cool things today. And what I wanted to do is that, like, when we are kicking off the workshop and we were starting, you know, video presentations, I really hope that by the end of this workshop, you'll be like, I could have done this, I could have done that. And maybe you'll go back to your slide and work on it later on as well. And we're going to be reflecting on it later on as well. So, bit of an outline for today. And again, welcome to the communications workshop. I don't know if you saw it, but I did write on the whiteboard as well that welcome to the comms one. We're going to cover why communicate at all as scientists. We have done the presentations. Then we're going to go into like tricks and a bit of framework for meaningful interactions. There's going to be a little bit of neurology, theory of change and diffusion theory. So we're going into like lots of different things. Then we're going to dive into writing, then presenting, and then all the communication assignments. So it's going to be very exciting. So why communicate to begin with? I'm pretty sure that this view of
Juniper, we're seeing that Yeah, the format in which you're displaying, I think, is the one that you're supposed to be viewing.
Oh.
We've seen the notes section. And the
Ah,
next slides are
let me. This is what Jail set up. I never use this presentation mode. So let me just do this. I'm going to start sharing again. Okay, can you see my screen now?
Yeah.
It's, yeah. It looks fine now.
The slide. Okay, fantastic. So to begin with, why communicate? And there is this kind of bad rep for scientists that we are on an ivory tower and we're doing world-changing things, and then we tell the people what to do, basically. And the public is someone that's kind of like a little bit divided, and there's this space between us. But this is actually a really it can be quite a harmful situation, and there's a lot of, in the past as well, there are lots of examples where this divide has created a lot of problems around the world. And there's a whole book that I really recommend that you read. It goes through so many different examples of how, scientists didn't really communicate really well with non-scientists, and it has led to health problems. It has led to distrusting each other, and just this whole communication was falling apart. And this is something that I'm so passionate about, because scientists know a lot of fantastic things, but sometimes you don't really know how to talk to other people. And I think it's not just something that we assume that we should know how to do, but it needs to be trained. And there's actual research of creating frameworks, how this communication should be directed, whether it is dissemination, with one-on-one, or it's being diffused and kind of trying to lead to change, in your community, or in globally and such. So this is what we're going to be looking into. So my background, I have been publishing articles since I was 14 in journal articles. I have been a big blogger. I have actually published my own magazine for my classmates, where all the undergraduate students were completely involved in designing the article, getting feedback and such. So I'm really passionate about it. And I have done a lot of outreach as well, in the UK and Europe and in Australia as well, and in Papua New Guinea, and wherever I go, I just love going up to random people and talking about science. I don't know if you guys have ever heard of Pint of Science in the UK. Basically, people go to a pub and they just talk about research in a pub. Soapbox Science, we went to a shopping mall, and in the middle of the mall, female researchers stood up on a soapbox and they started talking about their research to whoever was shopping. So it's really, really cool. And I don't know if you guys have done it, but I think it's a very valuable experience. In my background as well, I have worked in agriculture extension, so that's what I'm specialized in. Agriculture extension is basically being a pipeline between farmers and other farmers, scientists, tech guys, engineers, government, insurance people, investment people, and creating all these networks so people talk together and lead to a change. So the ultimate communication purpose is information sharing, but there are so many ways of approaching communication in the correct way. So if you have a bit of a workflow or framework for each interaction, it will help later on. And I really hope that, in the networking session, you had to do the whole what, how, why pitch. You had to do it in this presentation as well. You're going to have to do it later on as well. So hopefully it takes practice, but you get used to a different rhythm, and you'll find your own different frameworks as well, like what works, what doesn't, and you can keep trying it with other people. But some of the main things that you want to start with is that, like, what is your main message and purpose? What is your audience supposed to do with it? You have to like spell it out to make it quite easy. Then if we want to lead to actual change and innovation adoption and such, it's a whole discipline. There's social science, there's neurology. How do we actually lead to change? It's not just that, like, I have a pretty map and now the world is going to change. No, we have to have a communication plan in place. And this is something that's going to be in your assignments as well, that you have to have a think of how are you going to communicate this with the rest of the world. And building trust with the audience as well. It's kind of like being open about being scientists, and that, like, we keep proving and disapproving our theories and explaining this to other people, because otherwise it can be scientists can look really weird and they come across weirdos or very fancy people or something. But I think it's so important to just like establish trust whilst having chats. And at the very, very core, we'll go into a lot of details, but I have asked you in the pre-workshop survey as well, like, have you think of the best book or presentation that you have listened to? What did you take away? Why was it so good? And at the core, we want something useful or interesting out of engagement. You want something that you remember that it was a good emotion, right, out of that engagement with someone, and maybe something in common between the presenter or and as the audience. And I really love these examples. And I will be looking this up. And I really love that someone mentioned something that's not actual publication, but like Obama's speech was fantastic. So having a think of like what kind of interactions, talks worked in the past, take that memory and try to adopt it in the future as well. So I would like to kind of get this kind of flow, just introduce it to you guys and see if maybe this is something that will be helpful in the future. So to lead to meaningful interactions, if you start that, like, what is my message and why should anyone care? This is before even you have an engagement. So this is something that you have to reflect, at your desk or, whilst you're on a bus, like, what am I doing? What would be my message? Then you go for, who is my audience and how do you tailor this to your audience? What are their backgrounds? What are their, is there anything similar in between you and the audience? And you can actually ask. So if there is a two-way communication, I will give you an example soon. Then if you come up with a bit of a structure, again, this what, how, why really, really works well. Then if you keep practicing it, this will come naturally and it will be much easier for every interaction that you have. And then when you're executing as well, we say that, the clarity comes from knowing what your message is to begin with. Also include, body language. So actually what I love to do right now, it's sadly not the right room and everything, but I love standing up whilst giving a talk. And what you can actually start is that, like, when you're giving a talk in a big room or something, and maybe here's the laptop and you have a clicker. Come to the other side with the clicker, and basically you're going to be removed from looking at your screen all the time, right? And this whole movement between, like, the computer to the other side, that prompts people at the beginning of your talk. They'll start following you. Like, what is she doing? If, my screen would be here, I would be pointing, and then I go to the other side and point. And this creates something that's very dynamic and also kind of wakes up your your audience. So I really, really recommend it. I was trying to book out a room where I could do this, but everything was booked out, so I couldn't. I don't really like giving a talk while sitting down because there's more constraint and such. So I really recommend that one. And at the end as well, keep asking for feedback and have a think as well. How do you define what is good communication? And how do you get kind of like a little bit of feedback from any kind of interaction? And what are the actions that you're supposed to do later on? So just to give you an idea, I have I think I have done it many, many times with any kind of Uber driver, for example. I have a pitch about bananas because I worked with bananas. I can do this with sweet potatoes. I can do this with malaria. We'll look into it as well. So, for example, I have my audience, Uber driver. I want to talk about bananas. First ask, do you like bananas? Yes, I like a banana. Fantastic, great topic. With bananas, I work with the disease, but I also know a lot about economics and sustainability. So you can kind of have that conversation about like, do you know about, where your banana comes from or something like that. And you can build up this whole what, how, why. So I would be like, I worked with bananas by working with farmers in Costa Rica and researchers in the UK because we wanted to know if a new disease is going to wipe out bananas in Latin America. Then I would, communicate it as I usually do. I'm a very upbeat person and like I love, like using my hands, for example. If I have a banana, I would definitely pull it out of my bag. I do apologize, I didn't bring a banana with me today. But at the end as well, you can ask, you can kind of end the conversation with like, suggesting an action, like next time you see a banana, try to buy an organic one because that's a whole different production system. Or if you ever read another article or blog article that the bananas are going extinct, don't believe it because they are not. There are lots and lots of banana species, but the news outlets usually say that all the bananas are dying. It's not true. If I talk about malaria, again, like first question, do you know what malaria is? And I really like that in some of your presentations, some people did describe it because, who is your audience? Does everyone know it? Maybe not. Then I would say that, I work with malaria at the Children's Hospital in Australia. Everyone knows this place. I work with only data, but we are creating like spatial maps and everything to inform policymakers about interventions and such. We are funded by the Gates Foundation and we provide estimates for WH, the global team. And these are all terms that I know that in Australia, most people are all aware of. So these are hooks to get people interested. And I would say that, I'm a data scientist, so I don't actually work with people. And people are like, okay, but your work is still cool. And like, it actually helps people. And then the action would be just to talk about people. Do you like mosquitoes? No? Cool. I don't like them either. So it's kind of like finding the thread of, what is the right level of pitch? What are the right words? And as you keep having these conversations with Uber drivers, bus drivers, in the shop when checking out, you can talk to your dentist. You can talk to all your doctors about bananas. I have done it. And all of this is actually like you're gathering information, how to communicate all of this. So you have done all your pitches, which was fantastic. And just to reflect on it as well, that how did it feel as a presenter and as an audience? Because we are presenters and we are basically an audience as well. So I think as presenters, Nema mentioned it as well, that it was quite hard without the text, but it was really good with the workflow and such. So is anyone happy to talk about like being an audience member as you were listening to someone else's talk? What did you think? What did you feel? Is anyone happy to jump on? Anyone in the DAW office, feel free to jump on. Sangoro, you didn't have to give a talk, but you had to listen to everything. What did you think? How did it feel?
About your talk?
Yeah, listening to the presentations without any text and such.
Oh, yeah, that was pretty cool. I have some feedback, but I guess that's for later. But yeah, I think it's pretty cool, and given 3 minutes, I think about to overlook some issues. But yeah, I think it was okay. I think I have some feedback from Wende, Phoebe, Jacqueline, and Harriet, and Coco as well. Yeah.
Fantastic. I do like the overall feedback that it was cool listening to everyone. And I think this is a very, very important mindset, and we will have a chat about this as well, just to have that feeling that it was cool. But it also felt a little bit weird because this is not how you usually communicate, probably, that you have only pictures and no text and you have 3 minutes left. And I have already asked in networking sessions to follow this what, how, why flow. Why am I obsessed with this? Well, here's the answer. That we are going to be tricking brains with this workflow. Oh, how is that going to happen? So with the what, when you start with that one, the first words and everything, this kind of creates this mental label that the person can visualize it right away, like what's happening. The how is going to create this causal thread, which will be easier to recall for your brain. And then you say the why, because we want an emotion, like, why am I doing this? To save people. Oh, that's emotion, like why, why should we care? Basically, this is the answer. And that's going to be tying in with the prefrontal cortex as well and such. Nema, you have your hand up.
Yes, yeah. I have a question. So for these ones, to maximize the effect of it, do you have to vocally sort of like say them, state them out, or just like the flow of it by in itself is enough to take that? And then does it also have to be in this specific order? Because I know that some other people do start like with the why first, and then they go to the next levels.
Yes, no, thank you so much for the question. And in the next couple of slides, I will walk over a few more examples, because definitely we are looking for patterns. So your brain is looking for patterns. And as long as there is a nice and clear pattern, it's kind of, we'll go into this reducing the cognitive load, that we're not trying to find it, but we just listen and we find the pattern and we're following it, which makes it much easier. You can definitely have different cues, so it can be visual and verbal as well. And if you synchronize those two, that's the best kind of way. So we'll go into this. There are so many of these tricks, which I really like, but definitely you can use different flows as well. So it is all about kind of finding your own as well. But this what, how, why, I think it's a really, really nice one. And actually, when we're starting with a big prompt at the beginning, for example, this was my prompt where whenever I talked about bananas, put your hand up if you have eaten a banana this week. I started presentations with this, which was, everyone was like looking around. Oh, they actually asked, oh, I know a banana. Yes, I have eaten a banana. I'm going to have an action. And this one actually wakes up your reticular activating system as well, the alertness center, because I asked you right away to do something. So when all of you, I was like, okay, let's start sharing your screens. Let's get going. I'm pretty sure everyone woke up that like, oh, okay, we need to do something. Instead of just sitting back, laying back and just listening and thinking about the world's things. So if this is one flow that I, for example, really, really love for pitches, you have a big prompt. If you can have this prompt either with a crazy statistics, or if you turn it into a question for the other person to get them to think, and maybe try to get an answer out of someone that's going to wake people up. Then you're saying what, how, why. So just to go into a bit more detail, we have this pattern recognition. This brain is, we're looking for patterns all the time. We can actually recall things much easier where there was a pattern when there is a story. If there's emotion and memory, again, there's going to be more for long-term memory as well. If someone has given you a talk about their research and they say that, oh, by the way, I was there when a child had severe malaria and this is what we had to do and such. Oh, emotions. And that's something that people will also remember later on, rather than kind of just being that kind of very distant, cold scientist talking about facts. If you have a story and emotions, it will create a much more powerful story. And this cognitive load that I mentioned, this is basically that if we have patterns and emotions and very clear structure and spelling things out to people, like what they are supposed to do with this information, what are we doing, how is it going to, there are big visuals of a brain as well in front of you. All of this is reducing the audience to try to figure out what you're trying to say. When you don't know your own message, and this has happened to a lot of people, I'm sure to me as well, that I'm giving a talk and I'm like, I'm not quite sure what my message is. Then how would the audience, also be able to figure it out? If you have a nice structure, if you have visuals, if you're guiding your audience on your journey, they will believe you. They will be like, okay, this person thought things through. They put in a lot of effort to create these visuals. I can follow this story and I will believe them. And this is the combination of verbal and visual theory. So when you remember that I said that, why are we doing this? Because we're tricking a brain, a big brain jumps into your face. Hopefully this is something you'll remember later on, rather than having a big slide with a lot of text and everything. I remember that from Sangoro's talk when we asked post-workshop in the survey, like, what did you guys like? A lot of you put down that you really like the history of epidemiology and, the whole story around, the pumps and cholera and everything, which is fantastic. And that's what, that's what we are looking for. And when you have this visual and verbal stuff, that's a fantastic experience as an audience. And when you're telling a story as well, if you are, this is something that's much easier if you're in a room with people and you can kind of have these gestures, talk, interact with people and everything. You can actually have this neural coupling happening and your brain activity is synchronized, and it's a beautiful thing. I don't know if you guys have experienced it. This is something that's just super cool when it does happen. And mirror neurons, again, I'm sure that you guys know that we do mirror people's behaviors. So I have seen this a lot, that, I'm a very upbeat person and everything, the gesture, and then the other person, maybe they also start gesturing things in a similar way. Or if you're holding your head like this, they would be as well. When you're standing as well, you would be able to spot that they might be changing their posture as well. So all of these, something to keep in mind, that you can trick people's brains. Fantastic. And again, just to re-emphasize this storytelling element, that we respond to stories, visuals, and emotion. And because it sounds almost unscientific to do storytelling, it sounds like, oh my goodness, but if I'm giving a talk to big scientists, I can't really tell a story. But I really like this description, that thinking of stories as facts wrapped in emotions, that as scientists, we want the facts and everything. And if you put in a little emotion, and the visuals and everything, this is a beautiful thing. And I would say later on as well, we'll see, is it such a big divide between scientific and non-scientific audience? And after that, when you had all these amazing experiences, engagement, you have delivered your talk, then communication is basically a network of knowledge, and then hopefully leading to innovation. And when you think of like what's going to happen after you have done the communication, it can be dissemination when it's very controlled. I'm telling you, this about malaria in a meeting, one-on-one meeting, very controlled. This person should know this. But after that, that person might start chatting with other people, or the Uber drivers maybe are talking about bananas. I don't know what happened to that information. So it becomes unstructured. It's not really controlled, but it will be able to reach a lot more people as well later on. And this is just something I want you to think about, because when we talk about communication, it really shouldn't be an afterthought. Communication as a scientist, it is a lot of responsibility, especially when it comes to communicating about data that influences people's lives. So, when it sounds like, oh, this is a communications workshop, it's going to be quite nice and easy, just writing and presenting. No. This is important stuff. This is very much ingrained in our work. And, for example, the global mapping team here, they provide the estimates for this World Malaria Report that we've been sharing quite a few times. I really hope that you guys have all read it. The information that we had, this is now going into this diffusion of our knowledge. We have done some modeling here. We have come up with these numbers. These are the global case estimates. But now this is, accessible to everyone. People are using it. Policymakers are using it. Other researchers are using it. But we no longer have control over how are they using this. So we need to make sure that what we do put out, we have to have this plan in place. How are people going to be using it? How can we communicate it correctly as well when we're putting out information, that it will be communicated responsibly later on as well when it comes to that diffusion state. So I would genuinely like to say that communication should be approached as a research project. And that's why I mentioned this whole agricultural extension background that I have, because I look at it that this is research project. I want to know, how knowledge and information flows between people, and who it doesn't reach, who it does reach. And when we have information, I think as scientists, we do want to lead to some change or innovation or like a light bulb moment. To actually get to that, I really, really recommend approaching this in the future as well, when you're coming across, writing proposals, thinking of your own work, that to have this knowledge transfer of your work, this can be an actually multidisciplinary research project. You can do the modeling, and then you can actually team up with social scientists to actually how you get this knowledge out. That's a whole discipline. It's not easy how we communicate to whom to achieve something specifically. So in Australia as well, and I think it kind of originated in like Netherlands as well. There's knowledge brokers and innovation systems. There's a whole way of doing like this structural functional transformation analysis when you're looking at a whole country of all the different stakeholders and how you can pick pilot projects in order to lead to specific like economical outputs. It's like having an eagle eyes view of like how you get research to actually have impact on a whole nation, whole continent, or whole world. And again, this isn't something that just happens organically. This has to be planned. And whenever, you have any interaction as well, think ahead of what is the benefit for the other person. So I very much approach every meeting as well. And before I was extension group leader, and I put together a whole engagement plan for our team as extension officers, that we had to deliver some kind of information, some kind of benefit for every interaction we had with anyone else. You have to have some flyers nearby. You have to have apps on your phone. You have to have connections. So from any connection, you can pull out from this toolbox something that's beneficial for someone else. And this is something I really recommend again in the future, just to build up with this toolbox. And yeah, read up on social science. It's really cool. It's very different, but it's really cool. So theory of change. I really wanted to mention this because maybe you have heard of it. I don't know if you have ever used it, but it is a framework that basically lays out that you have some activities, you have intermediate outputs, outcomes, and impacts. This is quite useful for any kind of project management as well. And in research, if you mention theory of change, you make quite a few reviewers quite happy that like, oh, you actually thought of it. But basically just to have a plan how you're going to do something and how that's going to have an impact. It's a clear framework. I really recommend, I will send more information as well about this theory of change, because as it is in the name, we are creating a theory that we do something and it's going to lead to some change. But we have to define what it's going to be. So theory of change is our friend, because before we even kicked off this whole ECR cohort, this is why we have a lot of surveys, because I very much wanted this to deliver an impactful program. I think you read this in the introduction of the program itself. And that's because we have created a whole framework, how these different workshops, how the mentorship is going to build your skills and how that's going to lead to some change in the end. I guess I shouldn't tell you guys what we thought of that it will be the change, because it's still happening. But we can start by defining defining the theory of change of the goal. So I would say that if the participants can gain confidence, your attitude, they will apply more skills, and that will have a change in your behavior. So that's what could be measured later on. So again, so sorry for the surveys, but it's actually like it's helping us make sure that we are doing the right things and reflecting as well how we're doing things, and we are looking at your knowledge, attitude, and skills. You must have seen it that in these surveys actually there's quite a lot of overlap between questions, because when we have the knowledge, attitude, and skills session, it's because that's a whole other research component actually, that we ask you maybe the same question in two different ways and see if you have responded to it a little bit differently, maybe. So again, it's a very useful tool. Then we are deploying it, analyzing, and then interpreting and adapting the project as it goes along. So this is all kind of something just to think about in the future as well. And you can create something that's quite flexible along the way. With this one, I will share it later on just to see how CGIAR, this is like a global massive network of research institutes and organizations all working with food security. I'm obsessed with them. And they create these amazing projects to look at worldwide food security issues. And this is how the theory of change of one project is an example. So I really recommend you having a look at it as well, just to see how it just forces you to think things through, and it's visual as well. So let's say that we had some cool information It led to some change, and now it's spreading. Now this comes then to diffusion theory. And this is again, like my work was very much ingrained in this, and this one comes to like network analysis and such, and how this information is then going to spread in the world, how information about malaria or insecticide nets, you know, like how all of this is going to spread later on, which is mostly out of our control. And this paper, I really, really recommend reading it. It was written in quite an engaging style. You can read the first sentence. Innovations, the new practices, programs, and policies that we try and test and try again enter the social work profession and social work academic training and research committees from all directions and sources. But it might not always be the right thing. So it's a really, really good paper. I think it's a really good read as well. It's very enjoyable. And it comes to this kind of adoption curve. I don't know if you have seen it. This is quite well known, that first you have kind of like innovators, then early adopters, majority. This is the exciting stuff. If you're creating a powerful project, when like a lot of people have received your information, which has led to change. Then you have the late majority, and then you have like skeptics as well. And you can look at over time as well how this works throughout your project or after your project, which is fascinating. And in that paper, I really recommend as well looking this whole table, which is fantastic. It's about dissemination mistakes. And this is a really good prompt about our work, because I think as scientists, we have spent years on creating something, and we think that this is going to solve the world. And this is one of those communication issues later on with the non-scientists, that they look at us like, is that crazy? This doesn't help anyone. So it's kind of like making sure that like we do have, you know, the right approach. You know, we have to reflect on our perceptions as well, what we assume about the information that will influence decision making. Sometimes we think it will, but actually, if you look back and you're being very, very honest with yourself, you realize that, oh, actually, it's not that big of a deal for them. And if you're being clear that this could help them, but you recognize that it might not be the most important thing, people will listen to you a lot more than if you go to a meeting and say that this is going to solve everything, and then they're like, but this has nothing to do with my reality. So it's just like having these reflections even before your interactions and before, you know, we want to lead to change. It's very, very important. So, and again, over here, you can see that like we advocate single interventions as the solution to a problem. Very often it's not the case. So it's very important to communicate cluster practices and such. So again, I really recommend this paper. I will share it afterwards, just to have a read. And following this whole thread of, you know, how this information is going to get communicated and how we are up in the ivory tower, and some people might think that we're a different species or something. And I always remember this Newton quote about like standing up on the shoulders of giants. And, you know, that's how research works, that we are constantly approving, disapproving things, and it is completely fine. We have been brought up to think that we knew information, we can disapprove things. You know, when you're setting up a proposal, you're writing an abstract, you always start with, this has been proved, but we proved this. Yeah, we are constantly basically entrepreneurs. We constantly say that this has been done, but this is novel. And this kind of scientific thinking, that it's completely fine for us to be wrong 5 years earlier, because now obviously we know so much more. This kind of way of thinking is a privilege. It's definitely not something that's normal outside of our discipline. You know, when COVID happened, and that's where, you know, all of that conflict was happening as well, that like everyone was just getting so tired that all the scientists were changing their minds, what we knew about the disease, and like once this was the answer, next the other thing is the answer, and everyone was like, we want one answer. But as scientists, we were like, this is how research works. Every month we get new data, we have new conclusions. But this created a big communication mishap, really. So again, just being self-reflective and just not take it for granted that this is something that outside of your discipline as well, this might not be that normal. So just a recap, that I really recommend for meaningful interactions. If you kind of have this bit of workflow, with starting, identifying your audience, planning, executing, measuring later on, hopefully you remember some of the brain tricks, and that knowledge transfer really shouldn't be an afterthought. It is very much something that you have to plan and design for. So because we are running a little bit behind, so we are going to jump into writing. And I want to kind of start with writing that is just like Lego. We have a pile of stuff when we haven't done any writing. We have a lot of different pieces, why we did this, what we couldn't do, some tables, some really cool lessons. It's all a mess. It's all in our plate. This can be writing, this can be presenting, this can be basically my life, to be honest, represented on this slide. And what we need to do, just like Lego, we need to build. So I don't know if you ever have built a Millennium Falcon. We have built this with my big brother. It has 438 steps. And in Lego, when you have built it for yourself as well, you might have remembered that you build something, then you have to take it apart to fix it, then you have to build it again. It's quite nice that with Lego, you have like a clear instructions how to do it, but things can go wrong and you have to go back and forth. And that's just the way I think writing and presenting works as well. So as we start building, with the scientific article, I'm going to actually pause this. What I really recommend with everything, like with your communication, with presentations, plan. And when you look at scientific articles, we'll go into a few tips, but just general overview that you're starting with a general introduction, then you're being more specific with methods, more specific with results, and then you're going back to discussion and conclusion. So there's this funnel way of approaching things. I have embedded a presentation. It is by my former manager from the Plant Cell publication. It's a very high impact journal, and she was the features editor, and she's an absolutely amazing woman. And she taught me so much about writing and the writing process. And I worked with her almost for 2 years with, editing other people's work and writing and everything. I really recommend watching this because I think she does this description so much better about, coming up with your own workflow as well, how you're preparing a manuscript. And, when we're talking about scientific article, all of these tips can also be useful for any kind of report writing. So in your own time, I'd really recommend watching that video. And what I would recommend, again, I don't know, not everyone has published in our cohort, but nothing is worse than an empty Word doc, right? When we just have that big pile of Lego mess and we have no idea what to do. And this is the most important thing. You find your own workflow and don't think it has to be perfect. Nothing has to be perfect. It's so much easier to get through that brain wall if you write something even horrible, but it's a draft. If you start separating those Lego pieces into different clumps of this is going to be introduction, and just write a few headings and such. And I really recommend this paper. It's really nice and gentle introduction about like what Lego piece should go to which pile of stuff. My own workflow is actually I very much like to just jot down an outline. Think of the visuals, because I love visuals. If you can have like one figure, one table, another two figures, something that you can prepare from your own work, you're finding your own story. And then it's actually much easier to write methods and results. Methods is relatively, probably the easiest because you know what you have done. It's quite a heartless section where you're just writing things that this was done. Results as well, you're just linking it up to your methods, writing just bullet points and everything. And then you can actually go back into your introduction and discussion to put all this work, the specific stuff in your funnel, basically, and make sure that you're, referencing things and all of that is incorporated. So I hope it's helpful, and this will be useful when you're writing. If you're ever kind of thinking that, oh, I have no idea where to start, just draw stuff and start with a solid foundation. That's going to be the most important thing. When talking about writing, I love this stuff, going into sentence structures and taking apart an abstract of an introduction or a whole article. Every single sentence, you can tear it apart. So much fun. Yeah, I know I need to get a few more hobbies. I really recommend this book. I have put it on the recommended reading folder as well in today's workshop. It is from 2008, I believe. So a lot of it is quite outdated, but it has some spectacular tables that I will show soon. But let's look at sentences. So this one is something that is, again, it would be kind of like the text, like textless slides. One sentence, one thought. To try to follow this when you're writing is actually quite tricky, because scientists like to put in 4 or 5 thoughts into one sentence, because that's how like you start building it and it gets longer and longer and harder. But if you can keep one sentence and one thought, then the reading and the flow of the whole article is going to be so nice, and basically reducing that cognitive load stuff. That like, what's happening? I need to reread this sentence 3 times to understand what's happening. If you keep it one sentence, one thought, you can break sentences up. If anything is over 2 lines or 3 lines, you can find a way to just cut it in half, somehow break it up. It will be so much nicer for the reader as well. And when you look at the sentences themselves, you can actually put the actual words at the front. We won't have too much time today to go into like sentence building itself, but I really hope when you're going to be writing your assignments as well, this is something that you will notice, that you might write that, like, we did this and that and that and that, and then you realize that basically the last 3 words of your sentence is actually the point of all of it. So if you actually move those 3 words to the beginning of the sentence, again, you're going to be like responding to the what at the beginning of the sentence, which is going to help so much with the reading as well. When you're working on your paragraphs, so let's say that we have beautiful sentences. When linking up paragraphs, this is what I usually do, that I put it into bold, the first sentence of the paragraph and the last sentence of the paragraph. The first sentence should be a mini intro for your entire paragraph. The last sentence should be basically summing up the whole paragraph and introducing the next paragraph. This is something that if you put it into bold, the first sentence and the last sentence of each of your paragraph, you'll find it's such a beautiful thing when you do realize how you can connect and introduce these. And it's again going to be this beautiful flow for the audience, for the reader, just to follow your thoughts. And yeah, the whole experience just becomes so much nicer. And if you can try to have like one paragraph, one point, that's gonna be just again so much easier for the reader. So circumlocution, this is something that I think scientists really love, and this is something that from that Scientist Must Write book, please open up that PDF. You don't have to read the whole book, but if you go through it, you'll find basically a dictionary to normal humans, how they speak, and how some scientists speak, which I find fascinating. So let's read the first one. In virtually all sectors of the environment, you could just say almost everywhere. We could say there really is something of an obligation upon us too. It can be said we should. So circumlocution is basically the use of many words where fewer could be better. So here, an increased appetite was manifested by all the rats. Or you can say, all the rats ate more, right? And I think this kind of writing is something that like you might feel like this is how it might sound more professional or more scientific. But if you talk to, you know, scientists at the top and everything, they love this. They love it when they read something and it's nice and easily written and you just get to the point instead of like using 5 words instead of 1. It is completely fine when you're writing a draft to use all these words, but when you're going back and you're, you know, going over your draft, you will be able to spot it that like, oh, these 4 words can be replaced by 1. And it's a beautiful thing if you are able to spot these things later on as well. So again, just a couple more examples. You're going to say, make an examination of. You can just say, examine. It may well be that you can use the word perhaps. That's it. You know, in view of the foregoing, you can use the word so. In the nature of, like. So I really hope that this is useful. I actually used to print out the tables from this book, and I had it on a piece of paper with me when I was writing stuff in the beginning because my writing wasn't that fantastic. And this was just an amazing prompt for myself as well, just to reflect on my writing and how to like spot these many words and how to cut these out. And as an example, so I have given you a couple of examples how we can, you know, improve writing. I have uploaded this article again into the Google Drive. It's a Nature paper, very fancy. The effect of malaria control on Plasmodium falciparum in Africa between 2000 and 2017. Very beautiful paper. But let's have a read. So this is a sentence from it. In the context of evaluating large-scale anti-malaria strategies implemented over the last decade, an intricate geospatial framework constructed utilizing a multitude of heterogeneous data sources was deployed to quantify shifting patterns of Plasmodium falciparum endemicity within the sub-Saharan region, thereby enabling a multifactorial analysis of intervention efficiency. Oh no, right? How long is that sentence? How many words? How many commas? How many ideas are in that sentence? Hopefully, when you get used to this, to spot it in your own writing, you'll be able to be like, this is too long, I need to cut it out. So what we could do is that we basically developed a geospatial model using multiple data sources, routine surveillance records, household surveys, and climatic variables to assess changes in Plasmodium falciparum prevalence across sub-Saharan Africa. Isn't this much nicer? we're still telling what the data sources are, where it's happening, and then we say we're breaking this. This approach allowed us to quantify how interventions have influenced malaria transmission over the past decade. Perfect. Isn't it much nicer than detangling that long sentence? And if you want to say that it should be blog friendly, so like maybe not scientific, and I'm using an eagle because that's how I think of the blog approach, that we're having an eagle's eye view of the work that we have done. So this might be, okay, I wrote this up quite nonchalantly, I have to say. Researchers pulled together maps, surveys, climate data to see how malaria infection rates changed across sub-Saharan Africa. Thanks to this modeling, they could figure out if bed nets, medicines, and other prevention tools really made a difference. Yeah, maybe thanks to is not the nicest way, but again, we're conveying the same information basically, but using different words. Hopefully it's a bit easy to spot. Again, there's another example that it's a really, really big sentence. Let's read it. It was observed through the systematic collation and subsequent analysis of surveillance data that substantial declines in parasite prevalence were correlated in a statistically significant manner with heightened coverage of interventions such as insecticide-treated nets, thereby suggesting a pivotal role of these measures in the large-scale reduction of disease incidence. Oh no, right? It's pretty long. So we could say our analysis shows a significant reduction in parasite prevalence that aligns with increased coverage of insecticide-treated nets. These findings underscore the critical role of nets in reducing malaria burden. Bennett says, like, significant reduction. I still think it needs to be statistically significant to be a bit more precise. But again, you can see that we cut that sentence in half and used few words to explain all of that information in a much nicer, engaging way. Then in block-friendly approach, when people started using more bed nets, malaria infection rates dropped. In other words, simple nets were a big reason why malaria cases went down. Again, this is quite like a laid-back version, but yes, I think you guys are seeing a pattern, and hopefully this is something that was actually my job as a blogger, that I would get horrific molecular plant science articles, and I had to go through this process of reading these massive, massive sentences and trying to find ways of cutting them up. So we were editors as well for the scientific articles, and then I wrote an actual blog article. So this whole process was something that you get used to. It does take a long time, I have to say, to find the right structures, but hopefully it's quite nice that you can spot the long sentences, come up with a way to reuse it, and come up with a much easier way to talk about the fancy scientific words. And let's just say that, okay, this was kind of like the findings, and the block-friendly version could be that because bed nets and other mosquito fighting tools worked so well, it's clear that keeping them funded can push malaria rates down even more. Isn't that amazing? That's a punching, strong ending, because you're saying that it clearly showed what worked and we need more money. This is something that, like, again, if you can communicate this really well and easily, just leave the reader knowing what's the point, and you spell it out what needs to happen. So the whole paper, and I really recommend reading the whole thing, could be re-summarized. So do bed nets and anti-malarial medicines prevent a lot of malaria cases? And that whole paper I would summarize like this, maybe. a team of scientists used data from thousands of surveys and national control programs across Africa. They found that these measures prevented about 663 million malaria cases between 2000 and 2015, proving that simple tools like nets are powerful in saving lives. You'll see, it could be, it's very simplifying, and this is kind of like when science journalism comes into play, that there are lots of journalists out there that don't have the scientific background, and actually it becomes quite dangerous because the translation actually loses too much information, right? And this is why you need to have if you have the scientific background, actually, it's so needed for better communication as well, to have those two things, because I have talked to journalists who don't have a scientific background. This is literally just like a freelance job. They have to produce the words and they don't really read up on the actual research, and that's when miscommunication happens. So if scientists can communicate really well, and some scientists really cannot, but they are amazing scientists, they don't have to become communicators, but they have to be able to somehow get their message to the right communicator later on. So, but again, this information is just very important that you can communicate it well. So we have 20 minutes. Okay, presenting. What we're going to be doing is that, just a recap, that in the previous sections, we talked about visuals and storytelling, use of words, and the Lego stuff. And all of that is actually like intertwined. This whole communication workshop is intertwined because it's not just writing and presenting. All of these skills you can use in any kind of communication outlet or method. So in this section, we're going to focus on, again, Lego building for presentations. Then I will show quite a few PowerPoint tricks, and we will dive a little bit more into the non-scientific chats. But structure, I think everyone now knows that I'm a really big fan of planning things and thinking things out before we do things. And that's because if you are very clear with yourself or with your team, what your message is, that's gonna be that solid foundation of that whole Lego set, basically. That if you know what your message is, that's when you can actually build on that one. Until you have done this one and you start building a presentation without knowing what your message is, it's going to be back and forth with the Lego set. So if you can start with, again, just an outline, what signpost your talk. So that's why you can see I'm obsessed with starting a workshop with a clear outline, so you see what we're going to be covering. If we have something to track where our talk is at the moment, it's also giving a bit of indication for your audience where we are and how it fits into the whole workshop. And recaps and summaries, I think this is something that, again, just prompts people and will help with your long-term memory as well later on. I did do a communication training, and the person was saying that based on either research, you have to repeat something 7 times in order for another person to remember. And I think it was like a 3-hour workshop, and all I can remember is that, like, she repeated it 7 times, that you need to repeat something 7 times in order to remember. And I think all of us, we went away from that workshop not the happiest people, because she kept just saying, repeat, repeat. So I don't think you need to repeat something 7 times, but if you repeat it a few times, it is helpful. So when you're creating a structure for yourself for a presentation, again, sketching, flowcharts, draft slides are going to help you, go through like what you're planning, but also do have a think of engagement. How are you going to engage with your audience, and how we can use different tools to engage with your audience, whether if it is in person or if it is online. Have a think. How can we use this? And at the very end of this workshop, we will be using some tools, hopefully. And when talking about, we have kind of coming across a structure, but to talk about the mindset before going into a presentation, I've seen that quite a few responses said that you weren't that confident in your previous presentations in the past. So I thought I would share that I used to be terrified, oh my goodness, of talks. I used to shake, I couldn't eat, couldn't drink, was shaking, my voice would shake in the talk. So hopefully this is what helped me, and I hope it will help someone else. That you might have this, that, oh gosh, everyone wants to catch my mistakes. They want to look at my x-axis and they will spot something and they will call me out. What if they ask this? Oh, what will happen? And I want that noise to go out of our heads and have this voice instead, hopefully, if you can. I know it's easier said than done, but having a mindset that I have something cool to say, rather than everyone is out to get me. And the way I found this is that I've been giving talks as an undergrad, as a first and second year undergrad at international conferences, where I was the only undergrad as well. And I was just so out of place, and I used to be terrified. And then I can't remember which conference it happened, but I just realized that no one is expecting a lot of me. They are making presumptions that, oh, you're a junior person. Oh, we'll see what that talk will be, and then if you go in with the mindset that let's show them how it's done, let's prove them wrong. That's what scientists do. Right? We want to prove other people wrong. We want to show something cool. And that mindset for me has been really, really helpful. And I hope someone, maybe if you give a talk and you can think of this, and it will help, hopefully. So being perhaps underestimated is great, but we know stuff. We can trick
Juniper,
other people. Yes?
Juniper, the challenge is that there are people who know better than you. So how do you gather strength when there's an expert who needs to see my work?
Oh, well, thank you for that question. Well, I think this is the stuff that we know stuff. We know something that I'm pretty sure we know something that they don't. And if maybe you feel like they know everything, let's use some of those tools. If you give a presentation, let's make that presentation so bloody beautiful that even if they know stuff, they will be like, oh, that looked beautiful. If you found something very strange, or you talked to someone during your research as well, and you found something very strange, you can find that hook, that angle, that's going to be something that they don't know about. It's your story. I'm pretty sure that they don't know all of your story. And proving them wrong, I think that's how I work. I don't know if this is useful. I was actually I've been in a lot of meetings where I have had senior roles, and I'm there with very senior people, and they see me very young and blondish, and they don't know my background. And there was one meeting where my manager, who wasn't a scientist, we had a meeting with the director of a whole research institute, and we were supposed to put together a research proposal. And he went into the statistics that he talked to us like we were idiots. And all of a sudden I was putting down breadcrumbs to show that, oh, by the way, I used your R package. I know that you're doing regression. That's not going to be fantastic for our data because these are my assumptions. Oh, I have a beautiful visualization of the experiment we want to do, and it's going to show that this work is actually not fitting exactly what you have done before. And by the way, I know all those people who you work with, they are my friends. And within about 5 minutes, the director completely changed how he was talking to us, and he was talking to us respectfully. And it wasn't like, oh, we have to fight them or something to be taken seriously. Very nice and gently. I genuinely think that like there are ways of, if you trust yourself as well, gently and nicely you can communicate and kind of show your own story and power. I hope that that was useful. If you have any specific examples, we can go into it later. I really like proving other people wrong. And I don't know if anyone needs it. If you put in motivational speech in YouTube, there are like 2-hour talks. I sometimes listen to them before going into something. And it's an inspirational speech by like Denzel Washington about how you can do everything. Have that mindset, build yourself up, go in and prove them wrong. I hope that's useful. Or would you like to go into this, Rinde? Or we can chat about it at the end as well, if you'd like. Oh, good.
No, it was just a comment. It was just a comment. Yeah.
Oh, good. No, thank you so much again. So I'm going to show a couple of tricks and tools in PowerPoint that I have been using for quite a bit of time and how my slides have been created. I hope that these will be useful, and also I really hope that you will have assignments. I really hope that you will show us that you can use all these different tools as well. So first of all, when creating your canvas, like this slide or template, I really recommend going into View. You can put on grid lines and guides, so you actually see where is your middle. You put on a grid, you can change the grid. Slide Master, I will show it when we go into demonstration. You can actually create something that looks in how some of your slides look like. And it's very helpful when you're building a template and if you want to share it with other people as well. And the way this canvas has been created is that you can see that I always have a header. I always have this background as well, where the text is supposed to go, and everything is very much aligned. So all of that, you can go into literally just shapes. You put in a rectangle and you change the transparency of it. And that's how you create basically this template. So this is how it looks like. And what I will show is that we have these different objects. You can see that here, the manipulation isn't coming up. You can see the grid lines because this one is actually locked. So when you lock something, that means that you won't be able to move it around. So when I put on other objects here, it won't move. I have also locked that world map at the background because I don't want those to move as well. So locking is very, very important. Then for locking and then going into selection panel, actually, you will be able to see all. At the moment, I'm just going to show this to you guys, and you will be able to go through it in your own PowerPoint as well and how to use it. And with this selection panel, you will be able to select all your objects. You can lock things, you can hide things, and you can move things. So what you need to imagine that these are different layers. So just like ggplot, you remember? We have the different layering happening. So over here, what we would do is that you go into shape format, selection pane. This is all the objects that come from here. With this one, I can hide it. It's still there, but it's hidden. I can lock it here as well. And this one especially, you can rename things, which is actually really, really useful. This selection panel is very, very important when you have a million different objects and you no longer can select, something that's on your slide. Then go in here and you will be able to track it down. Then, oh, that one's correct. If we go and look for images and such, we want, and okay. You all have used maybe some pictures and pictograms and such that you put on your slides. I would really recommend, probably most of you know, is that if you search directly for PNG format, which is portable network graphics, which is actually a raster based file, then you will get the ones where you can remove, where you have transparent background. So here, if I search for mosquito, my browser is DuckDuckGo. It's a privacy thing, but like you can use this with Google as well. When you're searching for mosquito, you have actual pictures. But if you search for mosquito PNG, that's when you're getting all the pictures that are coming up with the transparent background. And when you're searching for things, again, you have the all licenses. It's the same in Google. Make sure that you're selecting all Creative Commons, just so there's no problem with licensing and such. So just to keep this in mind. So once you have searched for like a PNG, so here, this mosquito, if I click on that picture, it comes up like this. That grid in the background is indicating that it's transparent. You can Control copy it, Control V. So if you paste it, you know, all of that has disappeared. It's transparent background. And then you can add a nice little shadow, and it makes it kind of pop out a little bit. So if you go into picture format, that's where you can either pick the shadow here or the shadows there. There are lots of different versions. Shape format, it looks a little bit different how you find it. Then quickly with animations, I'm going to try to wrap things up quickly. I really recommend, you know, quite a few of you have used animations in your talk, and that really, really helped, right? With tracking what your point is. If you remember how the animations are, it's so powerful to help your audience follow your story correctly. What I really recommend in PowerPoint is that when you use the animation pane, you can play with whether if it starts right after something or with something, and you basically create this layer of different transactions, and you can select on click, with previous, after previous. You can change the duration and delay things as well. So it becomes a little interactive. Yeah, you will be recording your presentations in PowerPoint for the assignments. If you guys haven't recorded PowerPoint presentations before, if you go into the record menu over there, then you can set up your Cameo, this camera stuff, and you can start from the beginning, and you can change your view as well. Or you can also record in Microsoft Teams or Zoom by sharing your own screen. So this is how it would look like. You set up your Cameo over there. So we do have a picture of you, and you can start from the beginning, and you have to press record. It's not automatic. And you can see your notes up at the top. So quickly, transitions. What do we think? Probably not. That whole curtain pulling aside, it's very, very distracting. So if you do want to use some transitions, maybe just use the which looks like this. When it comes to visuals, and let me know. So it is 5 o'clock here. Do you guys have maybe another 10 minutes? Is that okay? If that's okay?
Yes.
Yes, sure.
Sure. Okay. So Lucid Chart, I think I've mentioned this before. It's an online software. I think most of you mentioned that you guys use Canvas usually for all the visuals or PowerPoint. Lucidchart is just another online software. I will share the link in the chat, or Gloria is doing that. Once you register for a free account, you can actually edit this visualization just to find out what works for you. And I think that's what I usually just recommend with tools that I'm going to show you guys now. Quite a lot of tools. And after that, go and play with them and see what works, and find what works for you. So again, I really like, this is like Lucidchart again, creating beautiful visualizations quite easily. And this is how I showed up for every PhD supervisory meeting, for example. I always had a beautiful figure to show to guide our meetings. And this was very impressive for my supervisors. They were like, I'm so ready, even though I created it in like 20 seconds. So this is something I really recommend for any kind of meeting that you have. If you can come up with like a little bit of like talking points and a couple of visuals, you're going to come across like such a put together person. So I have been able to fool a lot of people by just spending 20-30 seconds on a visual. And workflows, I actually visualize my workflows whenever I work with any kind of data as well, just as a prompt for myself, because I'm a visual person. Mark is another online tool, and I will share the link to this document as well. This is fantastic for like flyers or poster design as well, and everything is like very nicely aligned, and you can put bleeds on it. So like when you're printing it, you can kind of cut things and such. And all of this, these are online design software, which actually means that it's just like GitHub repo, if we're going back to it, right? Because with like a Google Doc as well, that you're sharing it with someone else can have different access to it. It keeps being pushed and pulled, right? And you are able to click on history and look at basically your version control. That's how a lot of the Google documents are set up, or the Google Drive. That's how, you know, like in PowerPoint, if you have linked it up with OneDrive, it's basically GitHub stuff. And this one as well, because it's constantly being saved and you can review what has happened in the past. So I know that people still have questions about GitHub, and this is something that we will keep getting used to it, because I think the light bulb moment happens when you keep using Git and GitHub and you realize how powerful it can be for project management. Then a shout out to BioRender. This, I think you can get a free account for 5 visualizations, and after that it becomes quite expensive. But this is like publication level visualization. You can ask them to actually draw stuff for you. I asked them to draw bananas, and that's why it's now available for everyone. And again, this is what I use for planning my PhD experiment. This is what I used in research proposals as well, to clearly outline what my setup is, what are my sample sizes, what are my treatments and such. So it can be so powerful. And again, this is something I created, and it's great. But a picture can be worth 1,000 words. Then again, when you have created beautiful things in ggplot, and next session is spatial data, so we will be able to create something like this. After that, you can put it in another software, and you can you know, draw stuff on things and link up with different colors just to make it more visual. This was my undergrad research. So in order to actually visualize what my data points look like, I put in a picture of the samples with the PNG format, because it doesn't have a background. I did like economic modeling and such. I stuck a banana on it, so the anyone who looks at it, maybe if you don't know too much about like what the actual analysis is doing, you know that it is about bananas. This is something I did for like farmers, that like a really quick visualization of different times, crop establishment, soil, stubble, weeds, and I literally just put a PNG on them or a pictogram, and it will be so much easier to like guide your audience through what they're looking at. But what am I talking about? I'm talking about all sorts of things, lots of different tips, lots of PowerPoints and pictures and everything. So we have been talking about scientific and non-scientific, and the question is like, is it actually supposed to be so divided that, oh, I should have written slides for scientific and then non-scientific talk audiences? And I think actually using the tools that you would probably think it's for non-scientists, like putting a banana on a graph, might be something that's non-scientific, but actually it helps scientists, I think. So can we use the storytelling and pretty slides to trick scientists? Would it be better to read an article with nice and easy sentences? Because at the moment, maybe it has felt that all the tricks I was sharing was maybe not for scientists. But what do we think? Would it be easier just to distract scientists with a pretty slide and one thought, one sentence, and paragraphs that are linked up together? I think, yes, we can trick scientists. We can trick with pretty visuals and storytelling. There is a big table I put together just so we do have this kind of bit of comparison of scientific audience and non-scientific audience, looking into purpose, depth of detail, language, structure, engagement, time format, and such. And after the workshop as well, you're very welcome to have a read and have a think if these are kind of correct. With the different flows as well, different presentations. And I would like to say that it's not that divided. I think both of these two approaches actually help with the other. Because when we dumb it down so much to non-scientific audiences, actually, that we get all the data out of it, actually our message kind of disappears and the actual audience won't trust us because we're treating them like they don't know anything. You can mention data to non-scientists, and for scientists, you can put pictures of bananas and tell a story to help them remember. So I hope that this is helpful. I think this is something that, like, when I was thinking of communication as well, I'd really like to make this thing that, like, it's not that divided, I think, in between. And just one more final caution that we can spot AI. I am from the generation that I learned to code and write without ChatGPT. And now everyone is I've seen students use a lot of AI, and I have to say it's very easy to spot in your scripts as well. If you create a script, and it will be quite easy to spot that this is all AI. So don't rely on it too much, and especially for writing. If you're writing proposals and if you're writing cover letters, there's software that's automatically checking everything for AI, which I find fantastic, that like an AI tool is checking for another AI stuff. But yeah, so you can use it responsibly, and we might cover this later as well. But just be mindful that we can spot it. So going into assignments and tasks after this workshop, and I really hope we have just quickly time to go over this. I would really like all of you to talk to someone in a bus stop about your research. Just go up to someone, have a think what your message is, and have a chat with them and reflect. Talk to Uber drivers, talk to bus drivers, talk to anyone like at the coffee shop as well. Oh, I talk about everything over there as well. Talk to a lot of people get that feedback loop somehow, like what is good interaction, what is bad, and then keep talking to more people and keep gathering data of like how is your engagement and communication is going. And I really would like for everyone just to have a thing that like communication is not it's not like a soft skill really. It's genuinely like it's so important that needs to be trialed and planned and everything. So assignments. You will have writing and presenting assignments after this workshop. It will be due by the 1st of April. You will have a 5-word summary of a scientific article that hasn't been published by you for a non-specialist audience. Then a 250-word abstract of your own research or made-up research project. So we have a non-scientific and we have a scientific audience. Then for presenting, one of them will be a 5-minute talk for, again, like you pick another scientific article for a general scientist audience. And then you're going to be pitching your research, either your research or your research project idea, like you're looking for collaborators. Now, all of this I have written up quite specifically about like a little bit of structure as well, how I would recommend starting with these different tasks. If you can start early, visuals for everything. If you can have a figure and you can basically recreate things in your own software. You can ask for feedback at any time, but it will be due by the 1st of April. And then we will actually have about 2 weeks just to make sure that everyone receives 2 feedback at least from your mentor and an independent reviewer. Everything will be basically open access, so on Google Drive. You will put it in your assignments folder. And I would really like to encourage you to be proactive, that you ask your mentor for feedback on these assignments. And then you can ask anyone in the cohort as well. Have a look. And I have prepared a scoring sheet as well. So get ready and get going. And I really hope that this will be really fun. I think I will let you all read the assignments, and then during the next session, I will just ask again if anyone has any questions, or, you know, during WhatsApp as well, feel free to ask. But it will be basically practicing all these skills. So for a recap, I would really like to test what are your takeaways from this workshop. So please log on to Mentimeter. So you can either use the link that I think will be in the chat soon, or you can log on to Mentimeter and use this code and just type in what your let me just find this link. Oh, thank you, Janice. I can see that you have put it in the chat. So what are the takeaways from this workshop? I can see that Kokoda, you asked about informational interviews. So we will go through those after the introduction to spatial data workshop. So next Monday, we will have introduction to spatial data. And after that, we are going to have the whole workshop about the informational interviews and how to publish to Git, because I think we are going to go through that whole workflow as well. And that will require some time. So in Mentimeter, please feel free to put down anything. Then it will be updated. I think over here. Can someone give me a shout when they have submitted a response, so we know if it's synced well? Thank you, Powell. I can see that you have to run. Thank you so much for joining and for your talk as well. Has anyone submitted an answer?
Yes.
Oh. Let me just check. It should be. Ah, there you go. Fantastic. Scientists Must Write. It's a great book title, isn't it? Skills, put action words first. Fantastic. Use less jargon, signpost. I hope that these are handy tips that will stay with you, and the workflows and such. And then please have a look at, with that Google sheet as well for your feedback. I hope they're useful. I will add a bit more feedback afterwards as well, because I was writing quite quickly. But thank you so much for your talks. I think they were absolutely fantastic. I know it was a really hard task as well. So that was beautifully done. And again, thank you so much. And I will take this away as well. These were the takeaways and such. So thank you. So just to wrap things up, with the GitHub repo, I only have had 3 people who have given me, added me as a collaborator to one of their repos. This is something that I would really like everyone to practice. I don't need to look at your scripts or how it looks like or anything. I just want you to find how to do it in GitHub repo. That in the previous sessions, we would have set it up. If you just go into settings, and then there's a collaborator tab, and you just put in my account name, Juniper PNG. We just need to know that everyone knows how to do this. Then please kick things off on your assignment and chat with your mentors about it as well. And for the next session, for Intro to Spatial Data, I will be leading that one. So if we can just get used to it, that before we kick things off, please set up a GitHub repo in RStudio. You can do that via RStudio itself. You can use it, the terminal, or you can actually start it from GitHub and then you link it into RStudio, or you can use GitHub desktop software as well. We have gone through all these different ways of doing this. So please feel free to set all of this up before we kick things off next time. And I really hope that that was useful. And thank you so much again for all your talks. And I will stop sharing. And this is the perfect time for me to ask for feedback. What did you guys think? What worked? What didn't work? Thank you so much again, everyone. How was that?
Yeah, it was nice. Quite learned a lot of things from the psychology behind and also the tools as well. Yeah, it was a bit lengthy, but it was very valuable.
Thank you so much. Yeah, I wish time for a break in between. It was quite a lot, so I apologize for that. The psychology stuff, I had this training where they were walking us through it, and I was trying to find the presentation as they were going through a different workflow, a different pitch, and how it was basically lighting up different parts of the brain. And I thought it was such a cool presentation. And I read so much about this as well, basically how you can trick people with beautiful visualizations and how you structure your words. And it can be really handy. Thank you so much, Janice, and thank you so much for the link sharing as well, Gloria, as well. I think she had to run. But yes, please, everyone, fill out all the surveys, especially that mentorship one as well, because I asked about future workshops, because we only have another 2 workshops planned. So it would be great to hear what you would like afterwards, if you guys are happy to jump onto independent projects, or if we should cover maybe INLA. Jalos is here, and the last time we were chatting with Powell and Rinde as well, they asked for QGIS. So Jalos would be able to do that if people are interested in just having an intro to QGIS session as well. So please feel free to fill that survey out and put down your ideas. And the last thing in that survey as well, I put down that I think in quite a few of your applications when you were registering and I was asking what you're interested in, quite a few people mentioned that they want to know how to train others. So I think it could be actually really cool if we had a workshop where you guys are teaching the rest of the cohort something. So everyone would have like 10, 15 minutes and you pick again like a subject and you give a presentation to teach a skill that you have figured out maybe. And then we provide feedback as well later on if people are interested. Yeah, we'll see. No. Well, thank you so much, everyone. I think I'm going to slowly wrap things up, if that is okay. Does anyone have any questions or anything? Well, we're all good. In the DAO office, please feel free to have a chat about your slides as well and your talks. Again, you guys did beautifully. So it was hopefully a fun little exercise. And it's always really cool to hear about all your work. All right. Hey, everyone. Well, I'm going to say goodbye then. Thank you so much, everyone, again, and have a fantastic time in the DAO office. And see you all next Monday. And enjoy the new camera. I can see that someone is really enjoying the controls. Is that you, Kokoda? Moving. It's brilliant. Okay, see you guys. Enjoy the office and have a wonderful week. Thank you so much.
Thank you.
Thank you, Juniper. Thank you for the work today.
Thank you so much. I hope it was useful.
Thank you. Sure. Hello.
Bye, everyone.